What is the Hepatitis Stigma Survey led by the World Hepatitis Alliance, and what insights have you gained from it?
My name is Rachel Halford and I am the president of the World Hepatitis Alliance. And on this World Hepatitis Day week, I'm just going to be spending a few minutes talking to you about the Hepatitis Stigma Survey, which we led, and a little bit about some of the insights that we'd learned from it, how this has informed our advocacy and strategy, and some core messages that the survey the countries could take from the survey and take into account when working towards elimination. So stigma and discrimination faced by people living with viral hepatitis, I think, as we all know, continues to be a huge barrier to elimination. We cannot address this, though, if we don't truly understand the impact on those affected. So with this in mind, the Hepatitis Stigma Survey was developed in partnership with ECDC, which is the European Centre for Disease Prevention and Control, and of course, people living with hepatitis. And we developed it to measure the stigma and discrimination experienced by people living with viral hepatitis. So it was piloted over a few months, just in 9 countries in the European region in early 2024. And what we learned from those initial findings was that stigma and discrimination have a significant impact on the lives of people living with hepatitis, and it impacts their willingness to engage and access healthcare, with 34% of those living with hepatitis C being worried that they would be treated differently by a healthcare professional. In addition, 46% of those living with hepatitis B thought it was difficult to tell people that they were living with that they had the virus, and as high as 24% had not even told their families. Stigma and discrimination is also experienced within sexual relationships, with 9% of those living with hepatitis B being threatened, verbally abused, or even physically harmed by a sexual partner. And I think it goes without saying that stigma and discrimination could cause emotional distress like depression and anxiety. And over 16% of those living with hepatitis C reported that they had moderate levels of emotional distress. So all of these percentages, all of these statistics that I've highlighted can be found in a full report and more in a full report of our findings, which will be released in the autumn. So I guess it's about, and just quickly to say that we do plan to scale this up, both within Europe and then globally.
How does this inform the WHA's advocacy strategy?
And I think we all know that data is a crucial advocacy tool. And what this will do is help strengthen our ability to be more effectively advocate to address the drivers of stigma and discrimination. The data, and critically the stories and experiences that people have been brave enough to share with us, will help us to focus on the most effective ways to drive change and improve the lives of people living with hepatitis. We will use this to shape future awareness campaigns, programs, and policy priorities so that we can effectively combat stigma and discrimination. And we will, of course, share all this with our members, give them the tools so that they too, on a national level, can be lobbying and changing systems. We hope that we're going to roll this out, the survey globally, and gather more data, which will enable us to continuously review and, of course, reshape our strategies as required.
What core messages from this survey should countries take into account when working towards elimination?
First and foremost, it cannot be underestimated, stigma and discrimination. And the reality is that countries will not reach elimination without addressing stigma and discrimination. Stigma and discrimination stops people accessing services. So countries need to make sure that hepatitis programs are comprehensive and include awareness raising activities within both key populations and the general population, just so that people are not stigmatized due to misinformation, so that they feel empowered to ask for testing and that they're comfortable and happy to share their status with friends and family. Education for health professionals is paramount, and a commitment to ensure that healthcare settings are free from stigma so that people don't avoid or delay accessing healthcare settings. Really strong anti-discriminatory laws to ensure that people living with hepatitis are able to work, study and travel. And I think just on the end there, programs should address not just physical, but both physical and mental health. And just finally, I think it's really important to say, central to all of this is the meaningful involvement and engagement of people with lived experience in program design and, of course, delivery, because what we need to do is change the conversation, and the best people to change the kind of conversation are the people with lived experience. Thank you.
We have just seen how two countries creatively turned challenges into opportunities for viral hepatitis elimination. What opportunities exist in Europe today that could be turned towards an elimination advantage?
Scientific breakthrough give us the unique opportunity to eliminate hepatitis C as a public health threat. European countries have put a vast efforts into strengthening hepatitis prevention with programs covering blood safety, injection safety, and infection control. Pan-genotypic antiviral regimens guarantee viral eradication in almost all treated patients, even without continuous monitoring. Most countries have established national strategies and are working with groups at risk to acquire infection to increase awareness to risky behaviors to prevent new HCV infection, expanding treatment and harm reduction measures. Modern diagnosis and telemedicine and IT and therapeutical tools are well established and offer several new opportunities. They can decrease the number of needed visits along the care cascades, given that the new diagnostics allow for easier and quicker HCV testing, ensuring higher linkage to care and treatment rates. Non-specialists such as general practitioners, prison doctors, or nurses can conduct screening as well as can prescribe treatment. Multiple examples of successful microelimination programs in target population indicate feasibility and cost effectiveness of these strategies.
What is most needed in European countries to advance the agenda on viral hepatitis elimination?
There has been notable global progress towards elimination of hepatitis C. Mortality from hepatitis C has declined since 2019, driven by an increase in HCV treatment. However, new estimations indicate that 78.6% of HCV infections still remain undiagnosed. And the question is now if WHO targets are achievable, because the European Union as a whole is not on track for HCV elimination, and this leads to several inequalities across Europe. And Egypt is an example of what could be achievable with modern tools and political commitment. Egypt had one of the highest prevalence of HCV infection in the world, and Egyptian program showed that a full elimination program must be coupled with active screening, awareness, and linkage to care programs. Through the nationwide campaign, routine testing was offered to everyone over 12 years of age in healthcare facilities, and through outreach programs in the community, with teams visiting big squares, markets, workplace, sports clubs, mosques, and churches, as well as public and popular places such as barbershops. Vulnerable populations such as refugees and migrants, and also people with disability were involved to leave no one behind. And in WHO, European countries, HCV elimination could be achieved if action are taken now. It is necessary to make hepatitis C and its elimination an adequately resources public health priority, to foster collaboration across a wide group of stakeholders to achieve elimination by increasing innovation, collaboration, and joint working, and to increase investment to integrate within healthcare system and scale up hepatitis case finding, screening, diagnosis, and treatment, simplifying the hepatitis response. Spending money today to control viral hepatitis will reduce the societal and economic cost later by avoiding its complication.